presenting here for a few minutes, and then we'll have time for media questions at the end. So if you can just save your questions till then, that would be great. And now I'm going to introduce Incident Commander Cindy Farr. Cindy?
Thanks, Allison. First, I just want to say thank you to everyone in Missoula County for working so hard to help get our COVID numbers down by following the local health regulations. When the restrictions were put in place last fall, we were seeing a huge spike in cases, and we've now seen a steady decline in our cases, and our incidence rate is now below the goal of 25 cases per 100,000 people, and it has remained below that goal for 2 weeks. This tells us that our local strategies are working, and our Board of Health will be meeting next week to revise the current restrictions that are in place here in Missoula County. Some of those proposed restrictions do include increasing the group sizes for events from 50 indoors and 100 outdoors, removing capacity limits except as necessary to meet the social distancing requirements, and removing certain restrictions on fitness facilities, pools, personal care businesses, and places of worship and assembly. Bars will be able to allow customers to order at the bar as long as there's a designated spot for that. And pool and darts would be allowed as long as social distancing can continue to be maintained. Self-service buffets will be allowed as long as social distancing can be maintained and food can be served in a way that reduces the contamination from common utensils. And lastly, revising the language throughout the rule based on input from community entities for clarity. Although Governor Gianforte is repealing the mask mandate for the state, during that same announcement, he voiced support for local authorities and their decisions to enact local mask mandates. One of the restrictions that will remain in place is the mask mandate for Missoula County residents ages 5 and over when in public spaces. The majority of other large health jurisdictions in Montana are also retaining that mask mandate. And scientific evidence shows that when used with other COVID mitigation strategies, such as social distancing, masks can reduce the transmission of COVID-19. In fact, the CDC published a study in November examining COVID transmission in Kansas, where there was an optional mask mandate, and found that counties that adopted the mask mandate showed a reduction in cases of COVID, while the counties that chose not to adopt the mask mandate actually showed increases in COVID transmission. Additionally, a recent study, lost my bullet point there. Additionally, a recent study that was published last month in the Journal of the American Medical Association found that up to 59% of COVID transmission actually occurs when an individual is not experiencing any symptoms. So it happens when they're either in that pre-symptomatic phase or in people who never develop symptoms at all. And mask wearing can help prevent these individuals from unknowingly spreading COVID in the community. While we have seen our number of cases dropping and we're actively vaccinating people in our community, we still have many vulnerable community members left to vaccinate, and we continue to have COVID transmission in our community. This means that it's important that we continue doing all that we can to protect the community, and that does mean continuing to wear masks, practicing social distancing, frequent hand washing, and getting tested if you develop symptoms. So again, I just want to say thank you to everyone in Missoula County for doing your part to help in helping to keep our case numbers low and helping us get through this pandemic.
All right, thank you, Cindy. And now we're going to hear from County Commissioner Josh Slotnick and Missoula City Councilor Amber Sherrill. They are our elected officials who are voting members of the Health Board.
Great. Thanks a lot, Allison, and thanks, Cindy, and thank you all for being here today. My message to you is short, just to say on the Health Board, there are 2 elected officials, one from the county and one from the city. As a county commissioner, I'm the county elected official on the Health Board, and we fully support this decision to maintain the mask mandate and to revisit some of the other restrictions. And we need to acknowledge, though things are getting better, we are still deep in this pandemic, and we are a ways away from removing the mask mandate, which I feel like is our base level of protection. This isn't up for discussion at the Health Board, as far as I know, and it's not something we will support. And we really do support the health officer's decision to maintain the mask mandate and to revisit some of these other restrictions, given that our numbers, our weekly numbers by 100,000 have reached our goal. thanks, Cindy, for passing that on, and I'll hand it to you, Amber.
Yeah, thanks. And thank you, Cindy. And I want to echo what Cindy said, just thanks to our community because, most people in our community have been wearing their masks and have been following the guidelines, and it's showing in our numbers. So, this effort is small with a big payout. It is not, it's allowing our schools to stay open. It is allowing our businesses to stay open. All of the things that, well, not all of them, but a number of things that our community has been worried about and struggling with over the last year, keeping our kids educated, keeping people employed. So, I fully support this as an elected official and as part of the health department board, and just I ask people to follow it. The governor has told us that this is falling to local jurisdictions. It's working. It's not that hard. So please, I just ask everyone to continue with it. And I thank everyone for their work in this.
Great, thank you, Amber and Josh. And now we will hear from County Commission Chair Dave Strohmeyer and City Council President Brian von Lossberg.
Good afternoon, everyone, and thanks, Cindy. Thanks, Josh. Thanks, Amber. Thanks, Allison, and everyone else joining us today. As you've heard, we are still deep in this global pandemic, and this is absolutely no time to let our guards down. Even though some of the numbers are trending in the right direction, we've got a ways to go to get out of this, and there are a lot of folks who need to be vaccinated still. This is something within our control to wear masks, and this is not just about my personal protection or my personal choice. This is about making sure that others around us are protected, and masks work. As Cindy mentioned, if you're asymptomatic, you might think that you're totally healthy, but you might actually be a carrier of the virus and unwittingly pass that on to others. So getting out of this public health crisis is everything to do with economic recovery in our community. In fact, economic recovery is predicated on us all emerging from this pandemic. So the Missoula Board of County Commissioners is fully supportive of the health officer and the Board of Health in continuing with the mask mandate in Missoula County. Thank you, everyone.
Thanks, Dave, Commissioner Strohmeyer. As Commissioner Slotnick and my colleague, Councilwoman Cheryl mentioned, they both serve on the health board as their elected officials, and I'm really grateful for their service on that board. It's sometimes forgotten or missed that council appoints someone from our elected body to that board. And again, I just want to thank Ms. Cheryl for her service. Thank Commissioner Slotnick for his service on that body. I'm simply here to reinforce the same message that our local mask order remains in effect, and how important, as others have pointed out, that is here in Missoula. My charge as a council member is the protection and benefit of the health, welfare, and security of the people. And I'm ever mindful of that during my tenure, and particularly as we've experienced this pandemic. And I'm mindful of that as I wear a mask. And if you know anything about me, this mask has sharks on it, and that says something in and of itself. Masks are simply vital in reducing transmission, and reduced transmission helps keep businesses open. It helps keep schools open. It helps keep our community safe, and it's really that simple. The health board and my elected colleagues who serve on that board have made recommendations and enacted regulations that are based on data and metrics. Science has informed their judgments and decisions, and I know it will continue to do so. And I'm really grateful for that. Our family, my wife is a type 1 diabetic, not yet vaccinated. And we have an 8-year-old daughter. We will continue to mask up And I ask that all of you join us and do this for everyone that you love in the community and for the community itself. So thank you.
Thanks, Brian and Dave. All right, and then we are going to have MCPS Superintendent Rob Watson wrap it up for us.
All right, thanks everybody. Thanks for allowing me just to say a few words today. This past Tuesday at our school board meeting, our school board unanimously passed our masking policy. This is a policy that administratively we've been working on for about 6 weeks, and we're ready to present it to the board on Tuesday, and it was passed by our school board. Under this policy, we will continue to require the use of face coverings in school buildings, on school buses, and really any indoor or outdoor school activity where social distancing is not possible. These requirements will be for students and staff and also any visitors to our school buildings or our activities. And also the policy will stay in effect regardless of what phase we're in. The school board had declared a state of emergency under COVID, and as long as that state of emergency is in place, then this policy will stay in place. I just wanted to mention, as a school district leader, we've been reading national guidance for about the past 8 months regarding how safe, how to safely open schools and keep schools open. All the guidance that you read at the national level from a variety of different sources recommend the use of face coverings as a key mitigation strategy to help limit spread in schools. We also know just from our own anecdotal information and data that we've collected since the start of the school year that masks help keep our students and staff safe, and they also help keep our schools open. So for those reasons, we will continue to support face covering policy in our school district. Thank you.
Thanks, Rob. All right, now we'll open up for questions. If you guys could use the raise hand function on the top right, I will go ahead and call on you. Maritza?
Hi there, thank you. And I think I know the answer to this, but I just want to be clear. Local penalties still would apply for violations of the local mask rule, because I know in SB 65 it kind of takes any liability out of that.
Maritza, I think I can answer your question, and I think the answer to that is yes. We do still intend to have to enforce the mask mandate in Missoula County, and that is, it takes a lot to get to a legal step, and so really, what a lot of our enforcement activities are really focused around education. And so we will continue to be, checking in different places in businesses and other establishments to make sure that people really are following the mask mandates. But really, a lot of our enforcement activities are going to be, are actually educational.
Peter Christian?
Yes, thank you for taking the question. I guess my question is, we've been going on like this for quite some time, and Cindy, you're probably the best person to answer this. Is there a benchmark where the health department, both the state and the city and county, will say, okay, it's over. We need to go ahead and drop the mask mandate. Everything's going to be fine, or is that somewhere far in the future?
So I think I can kind of answer that question, and the answer is we don't know how long this is going to continue to go on. We know that vaccine is coming in very short supply right now. And so until we can really get a large majority of our population vaccinated and create what we call herd immunity, which is where we have enough people vaccinated that we're no longer continuing to see large amounts of the disease in the community. Until that happens, we're really we will be continuing with the mask mandate. all of the restrictions are revisited every month at the Board of Health meeting. And so if at some point we feel like we're finally out of this pandemic, then we will, continue to revisit any restrictions that are in place and determine when we're ready to be able to lift those restrictions. The other thing that I just want to point out is that there are still a lot of unknowns about this virus, especially as we're starting to see variants popping up in other parts of the world and across other parts of our country. And we're not sure how long, how long immunity lasts after vaccine. And we're not sure at this point if the vaccine is going to be effective against those variants. So it could be a while before we're able to lift the restrictions and the mask mandate.
Thank you.
All right, Tessa?
Hi, yes, thank you. Cindy, could you just repeat what you said again in the beginning about the numbers doing better over the past 2 weeks for me?
Yeah, so our benchmark that we were shooting for was 25. It's a rolling 7-day average incidence of cases, and our goal was to get it below 25 per 100,000 people. And we've now been below that goal for 2 weeks. And so what we said when the restrictions went into place was, once we're able to hit that target and stay below 25 for 2 weeks in a row, that we would be revisiting the restrictions and making revisions. And so now we've reached that target and we're at that point where we're ready to lift some of the restrictions. Obviously, we're going to have to watch and see what that does to our case numbers. But right now, I believe as of today, we're down to 17 per 100,000, which is excellent. That's what we would like to see. That means that we're at a level where we can really control the outbreak at this point and be able to respond in the way that we need to.
Perfect. Thank you so much.
Does anyone on the phone have a question? Okay, I'm not seeing any other hands raised. So if anybody,
Allison, I
Yes,
see
go ahead.
Tessa's hand up.
yeah, Tessa, did you have another question?
Nope, sorry, just forgot to put it down.
That's okay. And Peter, did you have another question or was your hand just up from the last time? We're not sure. Okay. If we don't have any other questions, we can go ahead and wrap it up. Peter, did you have another question? Sorry, your hand is still raised and you're muted.
I'm trying to lower my hand. I'm sorry.
Okay. You're good, just making sure. All right, well, thank you all for joining us today. We will have a recording of this up on our YouTube channel later this afternoon. And if you have any other questions later, feel free to reach out. Thank you.
Thanks, everybody.
Thanks, everyone.